I'm going to tell you two projects, two stories, two case studies, if you will. This is one. So, remember our three questions? It's probably trying to solve, how will this widget help you solve it, and what data will you measure to see if it worked? Every project we do. So we got nurses, this is a portacath. This is a Huber needle that goes into a portacath. This was at VCU where I used to work. We use a bazillion portacaths here for our cancer patients. So back at VCU, we use 22,000 portacaths a year, and about 6 times a year, once every other month, a nurse would stick themselves with a needle, what we call a dirty needle. Dirty needle's been in a patient. And why did they stick themselves? When you got a portacath in your chest, it's a port under your skin. And the nurse sticks this needle in it to draw blood or to give chemo. And the needle stays in there. It could stay in there for days, maybe even a week. It gets nasty, it gets gunky. A week later, it's time to pull this out, and it takes some torque to get it out because it's gross, it's stuck. And sometimes yanking it out, they would stick themselves. Not very often, 6 times a year out of 22,000. I don't know if that's Six Sigma, but that ain't bad. But that's 6 times a year. And so we decided we want that 6 to go down or go away. What can we do? So we looked at a new product, and this is the product we actually use here at MD Anderson. We did not use it at my old place. Bring a new product like this in means you have to train all of your nurses in a new way. Have you met nurses? They're a pain in the ass. I'm the first one. I don't want to do that. I got work to do. Took us 6 months to train all our nurses in this new thing. And I'll tell you, the end of the story was, of course, we're tracking needle sticks afterwards. And we had 2 needle sticks in the first month afterwards with our new product. And went, holy shit. And after investigating, we found that those 2 sticks were from the old product that the ICU nurse had squirreled away in their office because they didn't want to change. Helped us change. But here's where I'm going with this. This woman I'm going to show you, her name is Karen Daly. She was the president of the American Nurses Association. And we brought her to our hospital to talk to our nurses.
I'm Karen Daly, president of the American Nurses Association. For 26 years, I was a staff nurse and loved my practice. I had a rewarding career and couldn't imagine doing anything else. But one day at work in the summer of 1998, I was stuck with a needle protruding from a sharps container. I didn't know it then, but my life was changed forever that day. A few months later, I learned that the fatigue, weight loss, and other symptoms that I was experiencing were due to hepatitis C and HIV that I had contracted from that needle stick. In the beginning, I didn't know if I'd survive or what my life would be like. I had to leave bedside nursing and I wasn't sure what I would do. One thing I was sure of is that my injury was preventable, and I didn't want to see this happen to anyone else. I turned my energy to that cause and found myself in the halls of the Massachusetts legislature and later Congress as an advocate for needle stick prevention. With leadership from ANA, support from state nurses associations, and grassroots advocacy from nurses and stakeholders around the country, we succeeded in getting Congress to pass the Federal Needle Stick Safety and Prevention Act. The law, enacted 10 years ago, requires that employers provide safer devices to protect healthcare workers from sharps injuries. It also calls for frontline workers to be involved in the evaluation, selection, and implementation of safer devices.
Stop it right there. The law says we have to involve frontline workers in the choices of the products they use for that reason. That didn't exist before this. This is old, obviously. We brought her in to tell her story in what we would call nursing grand rounds. So we'd bring 100 nurses in. She'd tell the story over 45 minutes. Then we'd bring another 100 in. She'd tell it again. And she did it for a whole day for free. She told that story like 8 times. Not a dry eye in the house. I'm choking up now. She went to work one day, did her job, came home with AIDS. We all have dangers in our job, but not like that. If we could prevent that, we could prevent somebody dying that we work with. And the pain that their family would face. We ain't saving money. That's not about money. This is about the quality and safety side of what we do. And so we had her do this, I'm telling you, all day long, for as many nurses as we could drag. The point was to convince them maybe we should change those Huber needles. We did that. We spent $8,000 more a year, trained 2,000 nurses over 6 months. I still keep in touch with my old folks there because I want to know this. 0 needle sticks after this for this item, for this Huber needle. That's 6 nurses a year that didn't get a chance to get hepatitis or HIV from a needle stick. Karen was an ER nurse. She's messing with her patient, uses a needle, puts it in a Sharps bin, and the bin's full and there's a needle sticking out, and that's how she stuck herself. The rules now are that Sharps bin gets 2/3 full, you change it out, put a new one in. That wasn't the rule back then. You're wasting space. What are you doing? Just be careful. HIV changed that. Nobody cared about hepatitis back then. When I was a nurse, when I started nursing in the 80s, we didn't wear gloves. I had blood all over me every day. When they told us you have to use gloves, and I had to put an IV in you, I'd cut the finger out the glove so I could feel your vein, because you can't do it with a glove on. I mean, I was a jerk. Don't make me change. You couldn't find a nurse now that wouldn't wear a glove. For this reason, for her reason. HIV changed our practice, like COVID has changed supply chain. She's, I can't even tell you how cool she is.